So you had a previous surgery. When was that previous surgery on your spine?
Yours was done a year ago, but then before that, it was probably maybe 3 years ago.
3 years before that.
Yeah.
And in that surgery, before our surgery, they went what a procedure we called ALIF, anterior lumbar interbody fusion, where they went from your belly. They fixed the problems, right? There were other surgeons there that they had to make sure your organs are not damaged on the way of going in from the front. And then they fix it from the front, then they turned you to the surgery from the back. And then and I'm just going to turn around here. This is what they did. They fixed these two levels, and then we noticed you have problem everywhere. We said we are going to stage it. And about a year ago, we fixed the problem above where you had the previous surgery because you had symptoms corresponding to that. Now, just going through both surgeries, open and the minimal invasively, tell me first, how was your open surgery 3 years ago? Or 4 years ago?
That was a really long surgery. I was on painkillers for at least 3 months.
And your kidney hit.
Huh?
You had a kidney problem.
Oh yeah, and when I was from that surgery, they identified, I started going to kidney failure during the surgery.
During the surgery?
Yes, during the surgery. So that I had to recover from that
yeah, you
versus
know, in
other
that
things.
procedure, we open up your belly, we push on the organs. Sometimes we push on the what we call ureter, where they take the urine from the kidney to bladder. And if there's too much pressure on that, yeah, people can develop kidney problem. It seems that you had that problem.
Yeah.
Now, that surgery, do you remember the surgery itself? How long it did take them to do?
Oh,
you said
it was a long surgery because they had to call my husband and tell him that you should probably just go home and wait for us to call you because the surgery ended up being a lot longer than anticipated.
How long did you stay in the hospital?
I was in the hospital a week.
A week, okay.
Yeah.
And how long after the surgery could you do basic things?
It was definitely quite a long time because when I came home, I had like a hospital bed delivered and all that type of stuff, and I had my mom over there every day helping me.
And almost about a year ago, I went and fixed exactly same level of the surgery, but 2 levels above it.
Yeah.
And part of my surgery was even actually open to access the previous screws and take them out. But still, more or less, I did identical surgery for you. My surgery was less than an hour. And my blood loss was like barely 3 ounces, much less. How did you feel? How was my surgery about a year ago?
Oh, I felt like I recovered so quickly. I mean, I was on pain meds for maybe 4 weeks, and then I was off of them completely. So yeah, I mean, just in that alone showed me how better a recovery I was going to have. And then then I went back and I to I started back at physical therapy, which wasn't too long after my surgery either. So yeah.
And as well, you told me that a friend of yours as well, got the same surgery, the OLLIF procedure. What did he tell you? What did your friend tell you, without telling the names? What did your friend tell you about the recovery?
Well, he referred her.
Okay.
Because he had such good results. He got up and walked out and he said, "You want to take painkillers?" He didn't, and he didn't need any. He had so much pain before he didn't even recognize his life was like brand
And the
new.
reason people feel good is nothing. It's really not magic. We don't cut the bone. We don't cut the muscle. We don't cause too much damage on the way of getting the job done. And that is why people recover so much faster. In your case, unfortunately, your problem was so big that we said we are going to stage it. So in the first surgery, as we talked about, we fixed the upper region, and then I took the screws out. Now that when we go back, the bottom disc, look at that huge black bubble there. It's actually that disc falling apart. We are going to go and fix it. And because I took the previous screws out, all of that I can do minimal invasively. And I don't have to open your belly or open the muscle and so on. And all of that we can do as well minimal invasive. But it is something I hear a lot from my patient, that if they had a previous surgery, they notice it's a day and night. What the different it is.
Yeah, because you can compare it.
Yeah. Now, any other question? Any other comment?
No, I don't think so.
Okay.
Well, can't wait to have it done.
Well,
I can't wait to have it done.
Yeah, we'll fix it.
It can't come fast enough.
Many times my take on things or fix this do the smallest possible surgery that can give you maximum benefit, and then just see how it goes. And if you need to fix more, we will fix more. But I try to stay away from those, horrendous all spine kind of surgery, because our body has certain amount of resources. It always works better if we fix one problem and then we add to it later on, rather than trying to fix everything at the same time. The analogy I use for that is like, imagine if you have something that weighs 200 pounds. If you try to carry it all at once, you're going to damage yourself. But your body has certain resources. But if you take it apart and make it 3-4 pieces, each of them a fraction of that weight, then you can safely carry it without causing too much damage. So the same thing with this. Some of my colleagues say fix everything at the same time. I don't believe that's a good option. Okay.
Right.
Well, thank you so much for the interview.
Yeah,